So, when I was looking at what our sort of next stage and next support of clinical decision making is, we still see clinicians getting a little stuck in certain aspects of the thinking of clinical decision making, right? It's not as easy as like your patient coming in with a textbook list of check marks. I've got this and this and this, and I don't have this and this and this. And then us being able to pick a perfect solution for them. That's not how it works. I mean, that's kind of how we write multiple choice tests when we're students, but that's not actually how medicine works, right? Patients come in with like 4 or 5 different medical conditions that are co-occurring at the same time, and a goal that like maybe conflicts with their own values, right? Like they want to be cured, but they don't want to take medication. And so how we move forward in this next iteration and next level of decision making is that we actually help you get more confident in these areas of uncertainty. And we take a stronger stance for how we want to show up and support each individual medical condition so that you actually feel like you have decision making framework to fall back on. Arguably, we've got these great standard of care guidelines, but they still kind of rely on things going like pretty seamlessly, right? Like we would say, oh, use CoQ10 here or use sage here. And then your patient's like, well, isn't sage estrogenic? And now, the support has kind of fallen apart because we didn't tackle that like unimportant cellular finding for that particular herb. And now the clinician is left trying to defend their treatment plan against a challenge that a patient has brought forward, right? Or perhaps your patient is looking for a magnitude of effect that we can't achieve, right? They want like 80% improvement, and the thing that we're about to give them reliably gives 40, right? That's problematic for the clinician. Like, how do we sit there in the discomfort of the patient's goals and our capability actually not being a match, right? How do we actually tackle that as an industry, as a profession? And so moving into 2026, our goal is to actually be able to help you build the skills that you need to navigate those parts of healthcare. And I do think, like, to future-proof naturopathic practice, we need to become much better coaches and strategists and actually not be the person who just gives doses of supplements or even interprets lab work, because now there are AI models that will do some of those pieces so much better than we can. So what's our role actually going to be? And it's going to be about helping coach people through medical decision making and uncertainty and accountability and behavior change and all the things that they need to be successful. But we're actually going to need to be able to do it with them, in a way that lets us actually exist beyond once AI can do like some significant portions of our job.